Simon Ateba from Africa News Today.
Thank you for taking my question. This is Simon Ateba for Today News Africa in Washington, D.C. Dr. Tedros just mentioned that Ghana and Cote d'Ivoire today became the first two countries in Africa to administer COVID-19 vaccine under COVAX facility. I would like to have a feedback. How is it going? Are there any reason why those two countries were chosen? And what's the next phase of vaccination in Africa after Ghana and Cote d'Ivoire? And finally, can you update us on how the vaccination effort are taking place in Tigray region in Ethiopia with all the crisis going on there? Thank you.
Thank you, Simon. Too many questions. Let me start with Dr. Swaminathan, Chief Scientist, please.
Thank you very much, Simon. Yes, I can start and my colleagues can come in. So we are delighted, as Dr. Tedros just mentioned, that the first vaccination campaigns have started using vaccines supplied through COVAX facility. As you know, the COVAX facility was set up in order to accelerate the development of as many vaccines as possible so that the world has a diverse supply of different vaccines to choose from and to suit different conditions, and also to ensure that there is access to everyone around the world. So this is just the beginning. And as you heard, we will have increasing delivery of vaccines this coming week. We know that there'll be at least 11 million doses being shipped from the Serum Institute of India to countries, not just in Africa, but in other parts of the world as well. We will also have shipments going out from the AstraZeneca facility in South Korea. So in the coming weeks, we hope to see more and more people, priority groups, healthcare workers, and other high-risk groups in countries being vaccinated, getting protected. We've seen early data from countries where vaccination campaigns started 2 months ago, the impact that this is having on reducing hospitalization, reducing death, particularly in the older age groups amongst the vulnerable. We've even seen very encouraging data on reduction in infections among healthcare workers who've received the vaccine. So these are still early days, but the signs are encouraging. The safety profile is encouraging. About 250 million doses have been given worldwide. And, so far there have been no major safety signals, so that's reassuring as well. And we're getting more vaccines coming through phase 3 trials, and hopefully we'll get into the COVAX facility. As you know, the J&J vaccine and the Novavax vaccine both have agreements with the COVAX facility to supply doses. So, of course, we are in a rush, we are in a hurry. We would like even more vaccines to go out so that people can get vaccinated earlier. But I think this week marks the beginning of what we hope, will be the start of a massive vaccination campaign. And as you can imagine, this is the largest vaccination campaign the world has ever seen. So we should not minimize also the preparations that countries need to make. The fact that adult vaccine programs do not exist in most countries, that health systems really need to gear up and do many things to prepare themselves, and not the least of which are training people, making sure the cold chain is there, making sure that the regulatory approvals are in place. We also have specific requirements on indemnification and liability that countries need to sign. I'll turn it over to my colleague, Dr. Simao, to explain why, certain countries are in the list. There's a reason for this.
Thank you, Simon, and thank you, Dr. Swaminathan, for the explanation. The issue of why some countries are receiving earlier than others is related to two things. One of them is the preparedness, because it's not only, we have more than 60 purchase orders already issued by UNICEF and by PAHO to different countries to address the needs of different countries. However, some of the countries had all the documentation ready beforehand. So they were receiving it. These two countries received last week, and we have maybe 11 receiving this week coming up. and in the next 2 weeks, a large number coming up. You know that after you have the emergency use listing by WHO, you also have to have the regulatory authorization at country level, and you also have to have what we call an indemnification liability signed by the country that's going to receive the vaccines. And this takes some time. Fortunately, most countries now are up and ready to move with the documentation, and we should see by the end of March all 142 countries that are part of the COVAX facility eligible for the AstraZeneca vaccines receiving vaccines in the next weeks and coming. Thank you.
Dr. Ateba, please.
Yeah, I think, Simon, thanks for the question. Your phrasing was interesting. Why were certain countries chosen? And in fact, we're not choosing countries. What we're doing is taking countries in the order that they are prepared and the shipment can go. It's as simple as that. So as Mariangela and Soumya mentioned, we have 15 more countries that'll be shipped to this week. 14 of those will be on the African continent. That's at a minimum. And then we have another same number that will go out next week. We're hoping to bring a number of those forward. So when you ask about the challenges to getting them out, part of it is in the in-country challenges, but part of it is just getting so much vaccine labeled, packaged, shipping space, and getting them shipped. So it's a massive logistical operation that UNICEF and PAHO, the Pan American Health Organization, are managing right now. And you asked a question as well about accessing conflict-affected areas, and part of the detailed planning for every single country, every single area involved in the rollout of these vaccines is to look at how do we ensure all populations are reached everywhere. And indeed, this was even a concern of the Security Council last week that passed a resolution ensuring that all countries prioritize all areas. So this is part of what we call the national deployment and vaccines or vaccines deployment plan of each country to make sure all areas can be reached. So with that, hopefully we've given you a bit of a flavor of the challenges at the national level to be prepared, but then at the international level to manage the demand.
Thank you very much. And for the second part of the question, we go to Dr. Ryan, please.
Thanks, Simon. Yeah, the situation in Tigray in Ethiopia remains of grave concern. There's been disrupted access to water, to sanitation, to food, to safe shelter, and to essential health services, including commodities and drugs that are life-saving. There's also been disruption of the COVID-19 intervention. WHO has worked to provide essential supplies to cover 450,000 people. That's less than 10% of the population for 3 months. But several health services, including maternal and child health services, have been very, very disrupted, and drug supplies remain critically low. The Ministry of Health is working with health cluster partners to try and make that situation better. But many are also living in overcrowded conditions in displacement camps with the greatest risks of diarrheal disease and other diseases, including sexual and gender-based violence. The overall risks of diarrheal disease, malaria, and other important infectious diseases will continue to rise as the population remains in these circumstances. Our primary aim as an organisation, wherever we work, is to ensure that all people have access to the basic, essential human right of access to basic health care. And within this situation in Ethiopia, in Tigray, whether it be in Yemen, whether it be in Syria, whether it be in Libya, Somalia, South Sudan, our primary concern is to ensure that human beings, Ethiopians who live in Tigray, are given that basic access. We will work with the Ministry of Health, we will work with health cluster partners, and anybody else who can help us to provide better access to the population there. So from our perspective, we are very concerned. A number of the factors, particularly the malnutrition status, that people already had issues of malnutrition before, and particularly water and sanitation. This is a recipe for epidemics. It's a recipe for malaria, particularly in malnourished children. The risk of malaria and malnutrition, and those of you who've worked in situations like that know what terrible and awful bedfellows malnutrition and malaria are. So there are significant, growing and extending risks to the health of people in the region, and we will continue, as I said, to work with our partners in the NGOs in the health cluster. We currently have staff based in Mekelle, and we are completing a full survey of all the health facilities that we have access to in order to assess the absolute functionality of those centres. But safe to say is the majority of health services in the region are disrupted and not capable of delivering the essential health care package that is currently life-saving.
Thank you all very much.